Good evening, everyone. Welcome to today's Q&A session. Myself, Dr. Tanima Singhal, and I welcome you all for today's Q&A session on Ask Me Anything related to breastfeeding. So let me start the questions. So first question is from Sumati. Facing low milk supply and not able to breastfeed due to flat and inverted nipples. So first of all, Sumati, don't worry about the size and shape of the nipple because we don't need to latch the baby with the nipple alone. It's the areola where we need to latch the baby. So if you are facing issues with the flat or inverted or small or whatever kind of nipples, then you need to work on a deep latching technique. So it is called as asymmetrical latch, where when you get the baby on the breast, then hold the breast in U shape from below and press the breast so that a pout is formed and the baby latches on the pout. So you don't have to worry about the size and shape of nipples, which will not cause any difficulty in latching the baby. Now, regarding the low milk supply, you need to follow some certain tips like like drinking more water, maintaining your hydration levels, doing oil massage and warm compress to improve the flow, following a demand and supply protocol. So like suppose if your baby is not at all coming on the breast, then start pumping. If your baby is already coming on the breast, then you start pumping after the baby's feeding sessions. So this will improve the demand, which will improve the milk supply. Also, you need to keep the baby skin to skin with you. You need to keep track of baby's weight gain. So this way you will be able to increase your milk supply if you follow all these tips. Next question is from Saloni, low milk supply. So already answered. Stuti, my baby is exclusive breastfeeding earlier, was on Katori feed. So I had to pump 6 to 7 times. But now do I need to continue pumping? Even though baby is taking direct breastfeeding, it is very exhausting. So first of all, Stuti, I understand that directly feeding is more exhausting than pumping. So I know because we don't know how much how much milk the baby is drinking and all that. So what you can do right now, you breastfeed the baby and then you see the color of the milk. If the color of the milk looks thick white, then you pump. Next question is from Anila, low milk supply. Already answered. Siddhi, I feel my baby is not latching properly. Her weight is gaining very slowly. So if you are feeling like that, how can you check? After breastfeeding session, you see the color of the milk. If the color of the milk looks thick white even after latching the baby, that means the baby is not emptying the breast properly. So you express the milk and give that hind milk to the baby. The baby will start gaining weight. Next question is from Urmila Rathod. Flat nipple and baby is not latching properly. Already answered. One of the mother also had the same question. Niharika, low milk supply. Already answered. Sejal, I am not able to feed my baby on the breast. I am pumping my milk to feed her. So what you need to do every bottle feeding session, you just try to put the baby on the breast. You need to make more trials. So if your baby is feeding 8 to 10 times, the baby's demand is 8 to 10 times, but you don't try even like if you try 1 or 2 times, the baby starts crying and you get afraid and you don't try. So don't do that. Every time your baby takes a bottle feeding, then you try to put the baby on the breast. If the baby doesn't come, then you pump. But you have to give all the feeding sessions trials. This is most important. Next is Deepika, breast milk supply. Already answered. Deepika, sorry, Vaishali. What is the milk regulation? How to cope up with it? So milk regulation is when your body knows what is the amount of milk required for the child and accordingly it keeps changing the composition. How to cope up with it? So if you feel your milk supply is less, then you need to follow the tips which I have given right now. If you feel your milk supply is good right now, everything is good, then you just need to create the proper demand and supply and keep working on it. Just need to keep the checking the baby's weight gain. If the weight gain is going fine, that means your milk is properly regulated. Sai Shanti, milk supply, already answered. Sakshi Gupta, low milk supply, already answered. Jaya, latching and low milk supply. So for low milk supply, I have already answered. For latching, what you need to do, if your baby is not at all latching or latching but feeding for long times and still hungry, then you need to make sure that the baby is doing an active feeding. So every time the baby feeds on the breast, you need to see the neck movements. If there are proper swallowing movements you can see in the neck of the baby, that means the baby is doing an active feeding. If you're not seeing the neck movements, only the chin movements, that means the baby is sleeping on the breast. Next question is from Shubhangi, feeding issue. What is the feeding issue? Akansha, my baby is 1.5 months old. She's on formula milk. She's not latching and starts crying on bringing close to the breast. I want to switch to exclusive breastfeeding. So if your baby is 1.5 months old and not latching, what is the milk supply? If your milk supply is good, then you need to just, as I just discussed with one of the mother's query, that every time your baby demands milk, you first try to put the baby on the breast. If the baby doesn't latch, it's fine, but you need to give trials as many times she's feeding. If your milk supply is low, then follow the tips which I have just given you on how to increase the milk supply. Bhumi, baby feeds only one breast. That's why breast size is uneven. So don't worry, Bhumi. If you're feeling like that, the other side where the baby is not feeding properly, that time you start pumping milk. That's all. Although breast size uneven is very common, if it is a very large difference, then only you need to worry. If small differences there, that's fine. Kandhimala, low breast milk, already answered. Soumya, milk supply, already answered. Asi, low milk supply, already answered. Priya Giridharan, so low milk supply, already. No, your baby is not latching. So first, let me know, because this question is not completed, not complete. Why is the baby not latching? Is it because of low milk supply or any other issue? You need to write your proper question so that I can answer. Sushmita, facing low milk in night, low milk supply. So if you're facing issues in the night itself, that means your baby would be doing frequent feeding in the night. In the daytime, when the baby is sleeping for long or giving you a gap of 3 to 4 hours, you need to express the milk in that time and store it in the refrigerator and use it in the night when you are facing low milk. Ajita, low milk supply, baby is four months old, given formula feeding. Just follow the tips which I have given you right now. But for 4 month baby, I would not advise you to keep waiting by trying yourself. You reach out to the team tomorrow and get your consultation done as soon as possible so that we start working on your milk supply on an urgent basis. Surbhi, I am a mother of a 1 month old baby, and from starting there is no milk or only 15 to 20 ml, and my baby cries louder when I try to feed him. He's fully on formula. I want to breastfeed him. So I understand your milk supply has been low, but it can be increased properly. So just follow the tips which I have given, and if you have already tried a lot of things, there is no reason for waiting to have an expert guidance. So we have experts in our team, and I also do consultations. Just reach out to the team and get your consultations done as soon as possible. Safia, low milk supply, already answered. Jennifer, baby refusing breast since a month, was on bottle and breastfeed with express milk, now completely bottle fed. So for bottle fed baby, to get the bottle fed baby on the breast, I have given the tips right now. You just need to follow them and try to get the baby on exclusive breastfeeding. Khalida, my child is not satisfied with my breast milk and I don't want to feed formula. She's just 21 days old. Hey Khalida, just 21 days, we can definitely get your milk supply up. Right now, I have given you the tips on how to increase the milk supply. Work on it. Just see for 1 week and try to follow it. If you are seeing results, keep moving. If you are not getting the results, that means you need to have a customized protocol. Reach out to the team, get a consultation done, and so that we can resolve your issues. Stravya, I have PCOD. Is there any relationship between PCOD and breast milk supply? I have twins, but I am unable to feed the babies, feeling very low. Only few drops of milk only I can see. Kindly help. Always remember any kind of medical condition. If it is not controlled or not in the regular, like not under control, then it might cause a problem. But if any medical condition is properly controlled, then it will not have any issues with breastfeeding. Now, you said that very low milk supply, very few drops are coming, then obviously we need to work on the milk supply. Follow the tips which I have given, but I understand with twins it is very exhausting. So better to have an expert guidance where they will give you a proper customized protocols. Otherwise, you can just follow the tips which I have given. Mridula, low milk supply, already answered. Mirali, low milk supply, already answered. Akshita, baby not getting up while feeding, sleeps in seconds. So if the baby is sleeping on the breast while feeding, that means either the supply is less or the flow is less or the latching technique is not correct. So you need to follow, or you need to work on all these three things. To improve the milk supply, I've already answered. To improve the flow, have good amount of water and also do oil massage and warm compress. To improve on the latching technique, you need to work on cross cradle hold, which gives you a very good method of getting the baby on the breast for a deep latch. Jyoti, nothing, just for general knowledge. Very good, Jyoti. Sumit, latching and low milk supply. So both I have already answered. So I don't see any new questions. Is there anyone who want to ask any more questions? Just let me know in the chat box. I'll wait for 1 or 2 minutes more. If there are no new questions, we can say a bye. Okay. Ma'am, how can I take guidance from the experts? Okay, so you need to reach out to the team tomorrow. So the team will have a call with them, discuss your issues. So they will guide you on what kind of consultation you would be needing. So in our team, we have four more experts also with including me. We have five experts, so you can have consultation with any of them. And also we have a dedicated latch expert. So if you have good milk supply but only latching issue, then you can reach out to the latch expert and have a call schedule with her. If you are having both low milk and latching issues, then you can have calls with any of us. You reach out to the team, discuss with them your issues. They will guide you on what kind of consultation will be good for you. Okay. Uh, okay, so that's all for today. Take care, everyone. Have a good weekend and enjoy. Bye.